This is Jake, 42-year-old male. He had roadside accident 3 days ago. He reported that since the accident he has been anxious and experiencing some difficulty focusing. He had few tearful episodes. He is feeling guilty because he thinks it is his fault. He reports a modest decrease in appetite. He has stopped jogging during his lunch break. He is still participating in community services. He has difficulty initiating sleep. He denies suicidal ideation or any other psychotic symptoms. Is it adjustment disorder or depression? Let's talk about it. Adjustment disorder is difficulty coping with stressful life events. Emotional or behavioral symptoms resemble less severe version of other psychiatric conditions such as depression. There are different types of stressors. It could be termination of romantic relationship, difficulty in business, marital problems, living in a crime-ridden neighborhood, going to school, leaving parental home, getting married, becoming parent, failing to attain occupational goals, retirement, and so on. The diagnostic criteria for adjustment disorder is the development of emotional or behavioral symptoms in response to an identifiable stressors, occurring within 3 months of the onset of stressor. Marked distress that is in excess of what would be expected from exposure to stressor, significant impairment in social or occupational functioning. The stress-related disturbance does not meet criteria for another medical disorder. The symptoms do not represent normal bereavement. Once the stressor has terminated, the symptoms do not persist for more than an additional 6 months. Treatment. Brief psychotherapy, either individual or group therapy, is beneficial. Biological treatment is benzodiazepines may be used for those with significant anxiety symptoms. Bereavement is normal psychological and emotional reaction to a significant loss. If a patient meets criteria for major depressive disorder, even in the context of loss or bereavement scenario, they are still diagnosed with major depressive disorder. After 12 months, if patient continues to experience intense sorrow, pain in response to the death, then may start to consider a diagnosis of persistent complex bereavement disorder. People who are going through bereavement, they may get into a habit to get excessive alcohol or use drugs or smoking. Therefore, it is important to screen for these things during that time period. We can also give grief therapy to the patient to help them to relax and to cope up with the situation. Pharmacotherapy is useful when there are signs and symptoms related to major depressive disorder. Back to the case which we have discussed in the beginning. Accident is the trigger. Duration is 3 months. He is more anxious than having low mood. Stop jogging does not completely support the evidence of lack of interest in activities. Maybe he has trauma secondary to accident due to which he's not being able to jog. This does not fulfill the criteria for anxiety disorder or major depressive disorder. Therefore, it is adjustment disorder. Thanks for watching.